Well, good morning, everyone. My name is Mairéad O'Driscoll, and on behalf of everyone in the HRB, I really want to welcome you all here this morning. It's a real pleasure to bring people back to a HRB conference in person again. The last one we ran, I think, was 2 years ago, 2020, and it was online, and it went very well, and the technology is fantastic. But there's no doubt that meeting in person is so much better. It creates so much more energy. It's been lovely to hear the buzz of conversation out there over coffee. And I think it also makes it much easier to network and to share ideas. So I hope you'll take that opportunity today. Now, before I move on, I of course have to do the inevitable little bit of housekeeping. So just to mention where the fire exits are, you can see them here behind me. I feel like the air hostess here, but they're here on my right and on my left, or in front of you. The restrooms are located in the foyer and also down in the basement. And we would say, out of respect for everybody, just to maintain a reasonable distance, because unfortunately COVID hasn't gone away, there are masks at the registration desk if you wish to avail of them, and there's also hand sanitizers around the conference venue as well. We'd also ask, please, that you ensure that your mobile phone is on silent, but if you could keep it handy, because you're going to need it. Throughout the event, we're going to use something called Slido. Now, I'm guessing a lot of you are going to be familiar with this, but if you're not familiar, it's a website, it's an app that allows you to put questions to the speakers, and it also allows us to put some questions to you, because we want this to be an interactive event. So, to make sure you're all awake, we're going to give it a go, to make sure everyone knows what to do. So you can see the instructions there on the screen. So if you go to slido.com on your phone, you can download the app there, and you enter the event code that's there on the screen, and you should see the Slido platform. And what should come up is our test question. And if you can answer that, please, we're going to check and see if it's all working okay. So we'll just give you a little bit of time to do that. Just hold on a second. There's the inevitable technical glitch, but we'll just give it a minute. Okay, while we're waiting for that to work, okay, I'm going to move on, and I'm just going to talk a little bit about the topic of the conference, why we chose it and why we think it is important, and we'll come back to that message or that question in a minute. So, as I mentioned, every 2 years the HRB brings people together in a national conference to talk about topics and emerging developments that are important to health and healthcare. And this year we're focusing on the whole area of personalised medicine, what it is, why it matters, what it means for healthcare, and how it can benefit patients, and what some of the challenges are in making it a reality and in putting it into practice. Now, what do we mean by personalised medicine? Or you may sometimes hear it referred to as stratified medicine or precision medicine. So very simply, personalised medicine is all about making sure that people get the treatment that's right for them at the right time. And you might say, well, so what? Wasn't that always the case? What's new? But of course, the big driver for personalised medicine is the explosion in the amount of information, health-relevant information, that's now available. So patient data, genomic data, phenotypic data. And at the same time, we have a big increase in our capacity to analyse those big data sets as well. So what it means in practice is that treatment can be much more targeted. So we know, for example, that people react differently to different treatments. Some therapies might work better for some people than for others. Some people are more susceptible to certain health problems. Or indeed, if you look at prevention, some strategies work for some people and they don't work for others. And of course, there's a cost to that. There's a cost for patients. There's a cost to the healthcare system. Because in terms of healthcare, some prescribing or practices might be wasteful. There's also a cost to the patient in terms of needless side effects or poorly targeted treatment. So, personalised medicine approaches hold great promise for better, more targeted approaches to healthcare. And we're going to be hearing this morning about that, as well as hearing about some very nice examples of how personalised medicine approaches are being used in practice and the difference that it makes. And of course, this is an area where it absolutely needs collaboration. So we have a very nice mixed group here today at the conference. We need collaboration between the health system, researchers, industry, patient groups, health professionals, and indeed the public. And we're only going to succeed in this space if we work together. But we also don't want to shy away from the challenges. So we're going to look at this from different perspectives. So for example, the way personal data is used. How do you balance out data privacy with the potential for using data for the common good? We're going to look at some of the economics and the ethical aspects. And there are questions of equity and value. How do you put a value on personalised medicine? And again, recognising that patient and citizen engagement is critical, how do we go about building people's trust in personalised medicine approaches? So to explore all of this, we have a great lineup of speakers for you, and it promises to be a really interesting day. And I think to start us off, I'm not sure if we have our Slido working yet. We do. All right, well, Gillian, do you suggest we check the slide? We have it there. Sorry, I'm not looking in the right place. Thank you. Okay, so we asked you the question. Let's go back to our Slido. We asked you the question here, how did you get here today? And so you can see what's come up. This is just a test question. You all told me you walked. I don't believe that for a moment. But anyway, let's it's only a test question. Okay. All right. So the real question we want to ask you, I'm going to get back on track now in a minute in our program. But the real question we want to ask you is our very first question. We want to open a poll. And so our first question is, what's the first word that comes to mind when you hear the term personalised medicine? What's the first word that comes to mind when you hear the term personalised medicine? So you've got 30 seconds to answer that. And what will happen is here, we're starting to see the words popping up there. They come up in a word cloud. And if some words start to get larger, that means more people have mentioned them. So we can see there what they are. Targeted, genomics, genetics, patient. Very good. That's the one that's center. Okay. What we're going to do, it's very interesting to see these. What we're going to do is we're going to ask you the same question again towards the end of the day, and we're going to see if there's any change. Okay, thanks for that.